Welcome to our virtual community chat. We are very happy that you have joined us this morning, so you can grab your favorite drink and let's chat and connect. Visiting Angels is a home care agency serving seniors in Maryland and Washington, D.C. We have a little over 21 years of experience in the community. We're excited to have our expert panelist here today, who is the Veterans Benefits Specialist with the Department of Veterans Affairs. He will be giving us some insightful information today on how to unlock benefits for veterans. We encourage you to ask questions by raising your hand. Alternatively, you may type in your question in the chat box and it will be read by our host, Dexter, who is our amazing digital specialist working behind the scenes. I'll go ahead and hand it over to you, Andrew.
So good morning, everyone. So as mentioned, my name is Andrew Rutherford, and I'm a Veteran Benefits Specialist with the state of Maryland, and I'm the Veteran Service Officer for Frederick County. But we partner, we have service officers throughout the state, so just regardless of where you're at, we can get you guys connected. All right, so sorry, my slides here. All right, so for today, we're just going to be going over some of the state programs that we have as a whole, just being that I work for the state. And then we're just going to be going over a little bit on the compensation side. And then we're going to be focusing on the DIC claims, survivor pension, veterans pension, and then just some general time just to discuss things. But as mentioned, if anyone has a question as it arises, feel free to reach out and to ask, and we can address it at that time. So just going on the state website, it's veterans.maryland.gov. So you can see all of our programs there listed over there on the side of the screen. Also, when you go to our state website, there's always a pop-up window that appears. You can put your email in there, and it just kind of plugs you in with things that are going on around the state pertaining to veterans, active duty service members, and things like that. That newsletter itself is controlled, managed, produced by the Community Outreach and Advocacy Program. And their mission is just to find innovative ways to reach service members, veterans, and their families, and just to educate them on VA benefits, resources, and other programs that we have. Anything to do with the website, social media, anything like that is all done by that particular program. Another program that the state has is the Maryland's Veteran Trust. It's a financial assistance program. Just as a requirements for it, they do require that you be a Maryland resident for at least 2 years. And then you also need a general under honorable or honorable discharge to be able to apply for that particular benefit. And then the other program that we have within the state, it's the Cemetery and Memorial Program. It's a pretty large and robust program in the sense that we have 5 cemeteries throughout the state. So it's just there should be one close to you wherever you're at. With applying for those particular cemeteries to be buried there, it's a free charge for the veterans. They supply the marker, the plot, as well as the liner. But as far as for the casket or cremation, that would be still the burden of the veteran or the veteran's family. We also have memorials located throughout the state, mainly through Annapolis and Baltimore. So you have the World War II and the Gold Star family in Annapolis, as well as the Vietnam and Korea War Memorial in Baltimore. We also have the Charlotte's Veteran Home, which is located in St. Mary's County. The state's also in the process of building a new facility within Sykesville. And that's projected to be done around 2028. If things are obviously, well, more than likely be delayed, but that's the target time frame. So if any additional information for admissions, the contact information is there. And then we're getting to the service and benefits program. So that's the program that I operate out of. And as mentioned earlier, I'm veteran service officer, so I kind of serve as the middleman between the veteran or the family and the federal VA, just to make sure everything's kind of squared away as possible, just to make sure everything processes as smooth as possible. And then we network with various community partners and military installations as well. And then again, as mentioned, we're going to cover the compensation portion. the DIC, and then the pension applications. Getting into compensation. So compensation, we use VA Form 21-526 Easy. The reason I'm, I guess, covering pension first, compensation first, is just because when we're looking to establish benefits with older veterans, we want to always look to see if there's a period of service that they served or a location that they serve that may be corresponding with presumptive conditions. Because typically the compensation claim is typically a better benefit through the VA than pension, and you're only entitled to receive one or the other. The benefit with compensation is it's not income based, and it's just directly based off of the service-connected disabilities established. For Vietnam service, there's a particular Agent Orange registry, which I have the link there, but we can get these slides sent out to anyone that needs them specifically. Same thing with Camp Lejeune. There's a specific presumptive condition list annotated there through the VA. Right now, I guess for probably the last year and a half, there's been a lot of publicity in general just on Camp Lejeune. That's legislation regarding that was originally passed in 2012 and then rectified in 2017. So majority of the things that you see on TV is just part of a class action lawsuit. But as far as the benefits that were there, they've been in place. So there's basically 8 conditions that they're working with specifically. So I just we can go to that link just to be more familiar with those. And if anyone does move forward with a class action lawsuit and there is a settlement, that settlement is typically paid out by the federal government. So if you were awarded any benefits through the VA, those benefits would then be paying back that award money, just because the federal VA is not going to pay out twice for a certain amount of money. And then the last one is basically the burn pit exposure, and majority of that was established recently with the PACT Act, which was August of last year. And that includes 11 cancers, 12 respiratory conditions. And then that is only specific for service in Southwest Asia. So that's basically Desert Storm, Desert Shield, OIF, OEF, and basically all the additional new campaigns. Again, there's a lot of misinformation about the burn pit exposure being applicable to Vietnam veterans when that's not necessarily the case. And then for the condition of ALS, that's just a presumptive condition of service. Anyone that's diagnosed with ALS can make a compensation claim for that. So those are the main things that I just kind of wanted to touch on with compensation. Just with the nature of what the call was today, we're not going to necessarily go through that form and how to complete it. So when looking at the first type of pension, so to say, is the DIC, which is dependency and indemnity compensation. And this is essentially a service-connected survivor pension. So this particular benefit itself is not income-based either. So if the cause of death can be contributed to a service-connected disability or presumptive condition that the veteran would have been entitled to that may not have applied for it, they can then basically apply for the DIC benefit. Or if the veteran was rated at 100% permanent total for 10 or more years, then you would automatically qualify for the DIC benefit as well. That benefit itself is a monetary award of $1,562 a month. If you're 100% for 8 or more years, there's an additional $331 that's added to that. And then we can also complete an additional form that just basically evaluates you by a doctor on how well you can care for yourself. Depending on how that form comes back, an individual may be, classified as either housebound or aid and attendant status. And if that is designated, there is an additional monetary benefit for that. So overall, looking at the benefit, it could be roughly around $2,200, which is just something to keep in mind. Because if the veteran was rated at 100%, and he passes, the benefits that the veteran have pass away with him, and then we would look to establish this benefit. But between the DIC and the 100% rate, it's anywhere between $1,000 to $1,500 deficit in income just moving forward. So that's just something to be mindful of. And then looking over at just the standard survivor pension, It's an income-based program that's designed to supplement income when majority of it's being used on unreimbursed medical expenses. For additional eligibility, the veteran needs to serve at least 90 days on active duty, with at least 1 day being during a wartime period. Not necessarily serving in theater or in country, but just in the military in general during an armed conflict, for at least 1 day to qualify for it. And then the veteran just has to have a discharge that's either general under honorable conditions or a honorable discharge to be able to apply for it. And then the survivor pension is paid out primarily to the surviving spouse. In some cases, there's for the children, if they're under the age of 18 or deemed to be permanently handicapped before the age of 18, that would be something that we could potentially look into as well. Just there is a income limit associated with this particular benefit. So number one, there's a net worth limit of $150,538. It does not include your primary residence or primary vehicle. They just don't count. So if you have your primary residence and you were to move into an assisted living facility, as long as the house doesn't sell, it doesn't count as an asset. Or as long as that house isn't being used for rental income, it doesn't count as an asset. But at the point that it would sell, then it factors into the assets. So sometimes we'll apply for the benefits, we'll get it approved, then they'll end up selling the house. That benefit will get severed because of their net worth, and then we have to wait for the net worth to go below the limit again and then reapply for it. For the surviving spouse, typically we're looking at a surviving spouse who needs aid in attendance for this particular benefit. So that income limit is 1,433. So that's the income limit as well as the maximum amount the VA pays out. So if an individual has basically an income of, we'll say $1,500 from Social Security, and they're paying just, roughly $400, well, we'll say $500 on insurance premiums, medication, copays, things like that. We report those unreimbursed medical expenses to the VA. They'll take that into consideration. The countable, because unreimbursed medical expenses are subtracted from your countable income to reduce it. So that would basically reduce it to $1,000. And then basically the VA would pay out 433 up to that limit. But in the same sense as if you're receiving in-home care or you're in an assisted living facility, which are also unreimbursed medical expenses, and those costs exceed the amount of income that you're bringing in, then the VA is going to pay that full amount up to 1433. Any questions there? And looking
Yes, we got a question here, Andrew.
Sure. Okay.
So this is from Avery Wilkinson, and the question is, how long does it take to obtain aid and attendance / housebound benefits?
Gotcha. So the typical processing time with the VA is about 4 to 6 months. If you know that you're going to be applying for it, you can always submit a intent to file, which will bookmark the effective date of claim and allows you up to a year to get that claim submitted. If you don't do the intent to file route and you're just submitting the claim, everything's backdated to the date that they receive the claim. So if it does end up taking 6 months, you will get 6 months of back pay. You'll get a lump sum payment and then the normal payment moving forward. So then supporting documentation, again, it's going to be the D-214, which is the discharge document. If it is a World War II veteran, they didn't have the D-214s at that time, so it's just basically a discharge certificate, but we need either or depending on the situation. And then typically we get 1 to 2 months of bank statements just for all accounts. And then marriage certificate, death certificate, and then direct deposit information. We also need, the VA has been difficult here recently, so we also need a copy of a void check as well to establish the direct deposit. It's always been in the fine print, but it's been something that's been enforced now probably the last month. So we just want to make sure that we get that's submitted with the claim so that there's no issues with processing. And then just going into the required forms here, I just want to touch on the income and asset form first. If the assets are below $25,000, or if there's less than 4 sources of income, we don't need that particular form. But as far as sources of income, the VA also looks at interest-bearing accounts. So if there is like a savings account that accrues 1 or 2 cents of interest on a monthly basis, that is considered a source of income and does need to be reported. If not, the VA typically kicks it back and says, you earned, 2 cents this particular month and didn't report it, please complete the form. So we just want to make sure that we're kind of thorough and looking at all the accounts that are there and just reporting all the information as we can, just to make sure everything kind of goes as smooth as possible. But the application itself for survivor pension, as well as for the DIC benefit, is the VA form 21P-534 easy. Again, that form itself is generally pretty straightforward, but that's typically what we assist you with, is completing these forms. If you're in an assisted living facility, page 19 of that form should be basically completed ahead of time before we meet. That just verifies the cost of the facility, as well as the type of care or services that they're providing. And then we also would require that the 2680, the examination for housebound and aided attendance form, be completed ahead of time as well. That form is completed by a doctor, and it just evaluates the veteran or the surviving spouse on how well they can care for themselves, and that just basically will grant them eligibility for the housebound or aided attendance status. So some of the other additional forms that we complete, I have the 21-0779 form annotated there. We don't necessarily need that form anymore, just because when they made the update to the 534, they included that information within the application itself. There's alternate signature form. The VA themselves don't necessarily accept power of attorney, so typically we get an alternate signature form, which allows an individual who has power of attorney or a family member to be able to sign majority of these documents on behalf of the on behalf of the surviving spouse. And then typically, if it is a family member outside of a direct spouse, we usually do the third-party disclosure form. And that just, if you need to contact the federal VA, having that form on file. Well, to be honest, spouses should do it as well. But if that form's not on file, the federal VA will not disclose information pertaining to the claim itself. And then the last form there is the representation form. That representation form is the form that, like, if you would work with me, would allow me to be able to have custodianship over the claim itself for all the VA files, and allow us to basically track that claim throughout the process. So whenever the VA would send out correspondence to you, we'd be able to see that information and basically follow along with you. And allows us to be able to get that information to the VA a little bit quicker as well. And then just transitioning over into veterans pension, basically it's kind of the same benefit that we just went over for the survivor pension, but directed towards the veteran themselves. So again, it's an income-based program, and it's designed to supplement income on unreimbursed medical expense. For an individual to apply, they need to either be considered permanently and totally disabled or over the age of 65. Countable income is, just all sources of income, and it just needs to be below that net worth, which we'll get to the next slide. And again, 90 days of active duty service with 1 day being a wartime period. And then also receiving a general or under honorable conditions or honorable discharge as well. So for the income limits for veterans pension are a little bit higher. So typically, again, if it's the veteran who needs aid in attendance, who doesn't currently have a spouse, that income limit is $2,229. Or if they do still have their spouse, that's going to be $2,643. Again, it's the same concept as the same exact net worth limit. Just keep in mind, I guess December 1st, that's when the cost of living increase is going to go up. So these numbers themselves will increase as well as that net worth limit. And I believe it's going to be by 3.4%. But those numbers will be sent out here shortly by the federal VA. But so when we're applying, we just need our countable income to be below that limit, and anything that's considered an unreimbursed medical expense subtracts from our countable income to reduce us under that particular limit. So again, supporting documents for veterans pension. Again, it's going to be the 214 as well as the bank statements as well, marriage certificate if applicable, and direct deposit information, including that void check. And then as far as the required forms for the pension, a lot of them, again, are pretty similar, except for the application itself. So the application for veterans pension is going to be 21P-527 easy. And then as far as the supporting pages, that's completed by either assisted living facility or in-home care, that is page 13 and 14 there. I know I didn't mention on the other one, but again, same concept is if you are receiving in-home care, that page just needs to be completed ahead of time. And again, it just lets the VA know what type of care that agency is providing. As basically, if there's no skilled nursing care in either of the particular situations, it's not considered an unreimbursed. It's not considered a medical expense. So sometimes we have individuals that are in independent living, even though it's an assisted living facility, until there's some sort of skilled nursing care applied, it's not considered an unreimbursed medical expense. But as soon as they would transition to assisted living, then that's when we can count it as a medical expense. Again, income asset form will need to be required if assets exceed $25,000 or if there's more than 4 sources of income, as well as the 2680, and that's just for the housebound aid and attendance. And then the other thing I just wanted to cover is just appeal options, which is, I guess, kind of more unique in the sense for pension, because the supplemental claim itself is used for file for increases, if you will say. So if you get the benefit established under basically just veteran with no dependents, just the baseline at basically 1336, we would complete the supplemental claim with the 2680 to say that, you know, the individual now is confined to their home, or they're now receiving in-home care or been transitioned to assisted living facility. So we need to basically reapply for that higher limit. We would do a supplemental claim, just reconsideration based off of worsened status. And then the supporting documents that we would use would be the 2680. In the same sense as if the medical expenses increase. So from the earlier example, if their surviving spouse just had their insurance premium medications, like their $500 of unreimbursed medical expense, they're now receiving in-home care and exhausting all $1,500 of it. We would do the new medical expense worksheet, resubmit it for reconsideration to get that limit bumped up from the 433 to the full 1433. The other two options, typically, I haven't really seen them come up with pension applications, but a higher level review would be if a claim was submitted and denied to the VA, and basically all the evidence wasn't taken into consideration. So I guess the example would be is we submitted the claim, we submitted all the evidence for unreimbursed medical expenses. The VA came back and said, we didn't find any unreimbursed medical expenses. Then we would do a higher level review saying, you missed this evidence, can you look at it again? That's where we would basically kind of do that particular situation. And then notice of disagreement, I just kind of put it on there, but typically that's typically it's for compensation claims and not necessarily for pension. And that's just looking at the claim itself by a direct law judge, but we try to avoid that option because majority of things can be settled through a supplemental claim or a higher level review, just because the nature of that particular process takes anywhere between 1 to 3 years to adjudicate. So we try to avoid that. Yeah, any questions at this particular moment?
Yeah, Andrew, so we have a question here.
Sure.
like a clarification question.
Sure.
If a surviving spouse with no dependents makes over $10,757 per year, then they are not eligible for any survivor pension, or are they eligible?
If that's an annual income, they should be eligible. So survivor pension. So the annual income for the aid and attendance rate is basically 17,192. So yeah, they would be eligible. Okay, so that number is based off of surviving spouse just at the standard rate. So yes, so at the standard rate, if their income exceeds that amount, then we would basically need the unreimbursed medical expense to reduce the countable income. So breaking it down to the monthly amount just is kind of an easier way to quantify it. So that amount broken up over a 12-month period is basically $896 a month. So for them to qualify for that amount, they would have to have, if they were making $896 a month, we would look at what unreimbursed medical expenses they have. So if they had absolutely no medical expenses, then they wouldn't qualify. But typically we would have basically the medications, co-pays, insurance premiums, which will generally add up to, I would say minimally of, $400. Like the standard, like Blue Cross Blue Shield, I know that's typically like $360, or if you're looking at your Medicare, which is around 168 to 184 a month, all of those can be used to basically reduce that countable income. So basically, to answer the question, yes, they would be qualified. You just have to get the unreimbursed medical expenses to reduce that countable income. So it's just about reporting the proper information to the VA.
Thank you for that, Andrew.
Sure.
That's the question so far. Please go ahead.
The Health Administration has some other additional programs. So I just kind of wanted to list them here. It's kind of outside of my lane in the sense that I just deal with essentially monetary benefit, the benefit administration, not necessarily the health administration. But I just wanted to present that information there, just because a lot of times some of the terminology itself is intertwined and can cause some confusion, because there's a aid and attendance benefit on the health side, which is the home health aid program, where the VA provides anywhere between 4 to 20 hours of in-home care a week, covered at the expense of the VA. But that benefit itself is through the health administration, not necessarily the benefit administration. But those two particular programs are often referred to as aid and attendance, one being a physical aid and attendance, one being a pension paid at an aid and attendance rate. The other, I guess, sought out program is the caregiver support program. I think one of the eligibility criteria for that is to have a service-connected disability established at basically 70% or more. But that is the federal VA compensating the caregiver. So if you're the spouse and you're providing a lot of care, you're the primary caretaker of the veteran themselves, then you would apply for that program to try to receive a stipend as the caregiver. But again, majority of this stuff is applied through the health administration, just because it applies, it processes much faster, because the VA looks at it as a prescription, just as the easiest way to put it, and it processes much faster. But again, the link there is at the bottom, but those are some other programs to look into as well. And that's pretty much the main points that I wanted to cover, and that kind of encompasses everything on the pension side with the VA. And then I touched a little bit on compensation, but if there's any specific questions, I can answer those, or if there's anything else that you'd like to see, you can let me know that as well.
All right. So here's another question. Who can we contact regarding the VA health benefits?
So typically, if you're applying for VA healthcare, I can always supply that form for you. The form is 1010 or 10-10 EZ. That form can either be completed and mailed into the VA, completed online, or given to your nearest community-based outpatient clinic. The outpatient clinics can process it, but I often suggest that you would go to one of the more regional hospitals. So that would either be Martinsburg for Frederick West, so Western Maryland, we'll just categorize it as that, or Baltimore or DC. So either three of those options would be the regional medical centers. They have an enrollment and eligibility center there. So you can turn in the application and the 214 there. And they also would basically take your picture and present and issue you a VA ID card, which is also your healthcare card.
Here's another question, Andrew. Who
Sure.
are the contacts for Charles County MD?
I guess if you follow up with me afterwards, I can look online just to figure out the nearest community-based outpatient clinic. Just being that I work in Frederick, I'm more familiar with that particular area. So I just follow up with me afterwards, and I'll research that for you.
Another question here. Is there any benefit that can be provided to hospice patients in a short amount of time given the urgent need for care?
There's an additional form that we can submit to expedite the claim. So we can do everything in our power to present it to the VA, but we are still at the mercy of the federal VA, unfortunately. But there is a form used to expedite processing of the claim. So that's what we would do in that particular situation.
All right. Those are the questions so far. Brittany?
Okay, if no other questions, then thank you for your expertise and sharing your knowledge, Andrew. We thank everyone for their time and joining us today. We will add Andrew's contact information in the chat if you would like to contact him. You may also contact us directly for more veterans benefits or resources. Stay connected with us. We look forward to seeing you for our future coffee chats, and we hope you have an amazing day.
Visiting Angels is an approved Veterans Affairs aid and attendance provider. For more information, contact us at 888-320-1994.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights. See you again next third Wednesday of the month.